Hello, and welcome to our presentation on physical activity promotion and residency programs as part of the Physical Activity Summit for AMSSM. I'm Stephen Carek, a family medicine sports medicine physician in Greenville, South Carolina with the University of South Carolina School of Medicine, Greenville.
And I'm Melissa, also a sports medicine physician at Oregon Health and Science University in Portland, Oregon.
As part of this presentation today, we want to review current literature on the state of physical activity education and residency education, present perceived gaps in literature for education, and share experiences with physical activity promotion and education at our institutions, and propose future directions for physical activity education, specifically presenting a possible curriculum from our work group. So to set the stage for physical activity education and residency programs, on average, there's somewhere between 2 to 3 hours of lifestyle education encompassing nutrition, exercise, obesity counseling, and primary care residencies. As a whole, this represents probably about 1% of total didactic teaching that a resident may participate in through their residency career. There's also a big gap in the number of programs that have a dedicated lifestyle curriculum. Within pediatric residency programs, probably about a quarter of them have a dedicated physical activity counseling curriculum. And there are significant limitations to why this is not higher, including provider knowledge, inability to maintain a curriculum. And despite residents knowing that exercise counseling is really important for patient care, most feel really ill-prepared to practice this in their future clinical environments. 96% of family medicine residents have reported exercise is important in practice, but rate themselves as somewhat incompetent in being able to counsel patients on the importance and benefits of physical activity. But what are the gaps? So there's gaps in education, including, how do we address this within residency programs? Programs like emergency medicine or physiatry may not even have any literature on physical activity promotion and counseling and a curriculum to touch on those subjects. And what does a successful curriculum look like? Is it a combination of didactics, patient simulations and OSCEs, direct observations by a sports medicine physician? And how can you translate it into clinical care, like practice-based improvement or quality improvement projects? I'm very fortunate at my institution in Greenville, South Carolina, that we have a built-out lifestyle medicine curriculum that dedicates about an hour per month on focused lifestyle lectures that touch on nutrition, physical activity, sleep, emotional well-being, and substance use. And there's a component of extracurricular assignments that serve to augment the didactic portion of this curriculum. We have an exercise vital sign, which some of you may have, that allows us to gauge a patient's physical activity as part of the rooming process for all our patients. And we're a partner in the Exercise as Medicine program, helping build a relationship with our local YMCA to serve as a referral network for patients who want to engage in a structured exercise program. Within the past year, we've even been able to build out a lifestyle medicine elective for our residents where they can directly observe programs like cardiopulmonary rehab, exercise as medicine, and even undergo cardiopulmonary testing themselves to learn their own baseline level of physical fitness.
Mine at OHSU is the opposite of Stephen's. Like many programs, it's a very jam-packed program with lots of great learning, but pretty much minimal to none of an exercise curriculum. So I have been exposed with QI projects, so I've worked with both residents and fellows to build an exercise vital sign within our medical records. I've also worked to help them promote that exercise vital sign. And then we have a resident working on providing exercise resources to family medicine providers to help with counseling. So the residency curriculum that was designed has 3 components to it. The first one is healthy behaviors. Second is exercise medicine and physical activity promotion in clinical practice. And third is self-care with physical activity. So to start with healthy behaviors, we want to identify the role of physical activity, nutrition, and mental health, sleep, and reduction of substance use in health promotion and disease prevention. So breaking that down, we want to describe how physical activity as part of the broader curriculum is focused on healthy behaviors and how can that be used to prevent and treat common diseases. And then we want to define motivational interviewing techniques that could be used to promote healthy behaviors.
As part of this curriculum, we want to have practical elements, things that residents can do within their clinical settings to learn these skills and practice them. An example in this case would be motivational interviewing techniques, documenting that those are occurring with about 10 patients over their residency career.
The second aspect of the curriculum focuses on exercise medicine and physical activity promotion within clinical practice. So we want the residents to practice physical activity promotion and exercise counseling during their patient encounters. They may need to start off with reviewing medical school curriculum, but then we want them to focus on learning how to assess physical activity levels during patient clinical visits. We want them to learn how to routinely write exercise prescriptions. And we also want them to focus on learning the billing and coding for physical activity promotion and exercise counseling. Within that second set of the clinical practice, we want them to promote community engagement. We'll have them identify resources available for patients to engage in physical activity. We want them to identify social and economic barriers to exercise for individuals within certain communities.
And for this element of the curriculum, we would love to see residents, practice writing exercise prescriptions, documenting up to 30 on things like aerobic exercise, resistance training, balance and flexibility, or disease-specific recommendations when they're needed. Record and observe 5 clinical encounters of physical activity promotion and review those. Examine a physical activity log for up to 30 patients. Perform 10 chart audits of receiving exercise counseling and with a coder to make sure they're documenting and billing appropriately. Utilize exercise promotion as part of a possible quality improvement initiative that focuses on improving clinic-focused quality measures like blood pressure, hemoglobin A1C, BMI. Identify 5 community or home-based resources that may be available within their health network. And then to serve as a medical volunteer for a community event like a 5K that's focused on engaging community in physical activity.
The third subset of the curriculum is self-care with physical activity. So we want the residents to understand that self-care can enhance their overall well-being, it can minimize burnout, and improve effectiveness of patient counseling. So we want them to learn how to develop a personal wellness plan.
And a way that we would encourage them to do this is by setting SMART goals, looking at these SMART goals regularly, updating them, and participating in local events like charity runs, walks, group fitness classes, etc., to get them engaged in their own physical health and well-being.
So there's some optional content for residency training enhancement. So how can you make this more effective within your program? So some ideas for that are to have the residents participate in a scholarly project. You could have them do a QI project, participate in journal clubs. You could have them do a discuss of the benefits of exercise and physical activity within a community group. They could serve as a longitudinal health coach with a focus on exercise and physical activity for a core panel of patients with chronic disease. And they could serve longitudinally as an exercise and physical activity mentor for patients with or at risk for pediatric obesity. You could have them create patient handouts for education and other materials for resources. And you could have them create exam test questions related to exercise medicine as well too. So then how do we assess the residents? And so some ideas for assessing them, some similar things to OSCEs. We're going to evaluate them on counseling a patient on exercise medicine and physical activity. Also in the OSCE format, we could evaluate them writing a written prescription. And then we could also do administering short answer essay exam questions or do an evaluation of a written description of what the residents would do in response to a patient case.
And in building this curriculum, it presents future research opportunities, like how does this curriculum affect patient outcomes? How effective is the curriculum on residency learning and their ability to apply exercise promotion within their future clinical settings? And hopefully with this, we can build an online structured curriculum and modules for all residency programs, regardless of specialty, to reinforce the principles of exercise, prescriptions, and promotion of physical activity. This ends our presentation. Thank you all for participating, and please feel free to reach out to us if you have any questions.
Thank you.